Hi everyone, and welcome to our webinar today. Hazel, our normal organizer, is at home sick, so I'm going to go ahead and start our program. My name is Caitlin Mock, and I am the registered dietitian that will be giving our webinar today. We're going to talk about social and societal and stigmas of weight loss, but first we want to get to issues or information that we have on our Facebook group. If you haven't already, please go to the Mexico Bariatric Services Facebook support group that we have. If you have any questions, comments, if you'd like to learn more about surgery or talk to other patients that have gone through the process, this is a great place to go ahead and do that. We also have our knowledge-based section on the Mexico Bariatric Services website, and that's under the support section. And that's another great place to get some information about surgery, to learn more about medical tourism and the services that are available to you. And again, another good place to kind of find out more from other patients as well. All right, let's go ahead and get started. So the stigma of obesity. Obesity is the only disease state in our society in which individuals are really looked at with harsh criticism and can even resort to self-blame. People can be deemed lazy, lacking self-discipline, sedentary by others, and occasionally they begin to believe these things themselves. And I think, the stigma, as the quote below kind of iterates, is that it's a widespread stigma, and it is associated with poor psychological functioning, poor academic performance, employment issues, and even relationship problems. And we know from research that this simply is not the case, but unfortunately it's the stigma that perceives in our society. I also want to point out that in this webinar that the bottom of each slide will be a link if you'd like more information. Wherever I put that link in at the bottom of the slide, that's the resource that I used for that specific slide. So you can either click on that if you get the slides, or you can just write that down and go to that website if you'd like to find more information. And I'll kind of be talking about those little links as we go here. So overweight and obese individuals often can internalize these negative images that occur in our society. Effects of stigmatizing obesity have not received the same attention, unfortunately, as the same issues as race and gender or religion. And even healthcare professionals can carry these stigmas. They can make patients feel embarrassed by their weight, potentially disrespected. And I've even had patients confide in me and say that they have avoided seeking professional medical care from certain providers because they've been treated so badly in the past. So we know from research that how you've gained the weight really only modestly affects the stigma associated. So in this study, participants were shown an image of a woman and were told that she had either gained her weight because of medical reasons or from what we would consider kind of more traditional reasons of gaining weight, whether someone was, overeating or living a more sedentary lifestyle. Once again, more of those stigmas that are associated with obesity. And what we found through that research was that those stigmas were still associated with the people that had gained weight, whether it was for medical reasons or, once again, those more traditional reasons. So the stigma was only a little bit less if it was for medical reasons, which is, I think, pretty interesting, and just goes to show you that, these thoughts and these stigmas are so strong. So individuals that have had weight loss surgery also, unfortunately, get kind of extra stigmatized by having surgery because it's often viewed as the easy way out. And I highlight this quote from Dr. Shabation in Los Angeles because I think it's a really good point that, it's not uncommon for people to think that because a person had bariatric surgery, he took the easy way out in achieving weight loss. Often, though, it is a life-saving measure for those who have tried other methods such as diet and exercise without lasting results. However, serious lifestyle changes are necessary in order to make weight loss goals a reality. I think that quote's so important because we often think of weight loss surgery as more of a cosmetic surgery than the true life-saving measure that it is. And I know as a community and as patients and a medical provider myself, most of us do think of it as that medical saving procedure that it is, or that life-saving procedure that it is. But again, it's often perceived as more of an enhancement kind of procedure, almost as if a facelift. And so this is part of that hurdle that we have to climb and that we have to educate others on as we try to reduce these stigmas and to change this thought process. So the stigma of weight loss surgery again. In this study, researchers noticed there was a weight bias with employability. So participants were shown an image of a woman and they rated their impression of her. They were then shown an image of the same woman prior to her losing weight, and they rated her again. These same participants were then told on top of that the woman had either lost weight with surgery or with diet and exercise. And what they found was these participants rated this woman better if she had lost the weight with diet and exercise than with surgery. So again, this is a negative stereotype, a negative stigma that was associated with the surgery, and really unfairly. But it just goes to show you once again these hurdles that we kind of all have to overcome as a community. So how do we do that? In this study, researchers found that when they educated participants about the lifestyle changes that were involved with going through a type of bariatric surgery, and they didn't specify necessarily which bariatric procedure, but really any kind of weight loss surgery, those participants understood more and had a better or had less negative evaluations of surgery once they understood everything that was involved. And I think this is really what we're going to kind of take from these different studies and kind of apply to the rest of our webinar, that educating people on everything that's involved in surgery and the different changes that need to happen and what your body goes through and the lifestyle changes that happen is really going to be the best way to change these stigmas and to change these stereotypes that we all experience. So we start that by, educating, like we said, obesity is a medical condition. It's not a label. Explaining to people how surgery is your tool to help you get healthy, just like any other surgery is there to help with your overall health. No one questions someone that has a knee replacement or a surgery to remove a cancerous tumor, right? And it's the same thing with weight loss surgery. It's there to help you get healthy. It's a faster way. And it's the same thing with, once again, any kind of surgery to remove a cancerous body. We don't tell someone, oh, go on a vegan diet when they have cancer if surgery is an option. And I think that's kind of how we have to look at weight loss surgery as well. It's a more efficient way to remove the weight that is a potentially life-ending or life-changing consequence for someone. So you can do this by talking about the surgical processes, what leads up to surgery, how you did your research to decide what surgery was best for you. Discussing the 2-month postoperative diet is important. And then, also as a community, we need to educate and we need to encourage patients that have had surgery and that have had success to continue to talk about their surgery. And I've noticed as a healthcare professional that those that have had success tend to stop talking about it several years after surgery, and they stop talking about surgery for various reasons. Maybe they just don't think about it as much as they used to. The first year to 2 years after surgery, it's still pretty fresh, and almost every part of your day kind of revolves around, thinking about a meal, preparing for a meal, waiting between meals to eat or drink, planning your exercise. But as time goes on, that just becomes more of a habit and you don't have to think about it as much. And so for those people that have really had success, they don't have to think about those things as much. And so it just kind of naturally becomes something that they don't talk about. Now, when I say people that have had success, I don't want to spread the impression that these are people that have gotten down to their absolute ideal weight and don't have any issues and never have weight regain, because that's simply not the truth. People that have long-term success continue to struggle with the weight. They may at times, gain 5, 10, 15 pounds in 1 year and then have to kind of, rein it in the next year and do a different exercise regimen, or try, meeting with a dietitian again to work on some issues. So these aren't people that have been able to do it without any help at all after surgery, but they've found a way to kind of find that balance. People also stop talking about surgery for various negative reasons, and these can include the stigmas kind of that we're talking about today, that people have negative comments towards them, that people don't think they've had as valid of weight loss because they did it with surgery. So these are all things to kind of be aware of, and to really, when you do find someone that's had surgery, to really try to support them and to ask good questions and find out what you can from them to help with your own success. All right, overcoming the stigma of weight loss surgery kind of continued. So educating others on those lifestyle changes, I think this is one of the most important things, again, and really breaking it down into taking time to plan meals, preparing foods and having healthy foods available for meals and snacks, having regular exercise and incorporating those activities, telling people kind of how you're doing that, explaining how you're trying to be a more mindful eater, working on that philosophy of all foods and moderation. I think a lot of people that know we've had surgery want to kind of, put you under a microscope and look at every single thing you eat and kind of judge you. And if there's anything that's, slightly unhealthy that you're eating, they want to kind of jump all over it because, you had surgery and you're supposed to be eating perfect. And, none of us are perfect. That's not the way I want you to eat. That's not the way you should expect yourself to eat. We all have to eat everything in moderation. And at first, some foods may be more difficult to eat, but over time that usually dissipates and foods become easier. But kind of explaining that philosophy to people, I think, is very important as well. And then overcoming those psychological relationships with food. That's a very challenging issue in and of itself, and something that, if you've struggled with emotional eating or stress eating, maybe addictive eating, these are things that don't go away with surgery. And so, explaining to people that these are issues that maybe you yourself aren't continuing to work on, but that people do continue to work on even after surgery. So some of the psychological changes that occur after weight loss surgery, people can continue to feel obese or believe that they're perceived as obese after you've lost weight. And this can be something that takes, months to even years to really change. I've had a lot of patients really struggle with that body image of what they look like once they are thinner. Other things that can affect your psychological health are just your relationship changes. Most of the time, it results from feeling more confident and having more self-confidence. But sometimes that can kind of go the opposite way as well. I have had a few patients that felt a little bit less confident after surgery, and that usually went away. But it's more so just kind of getting used to your new body and the way you're perceived. Relationships that are already healthy usually tend to stay healthy after surgery. Again, that confidence piece has a lot to do with it. But unfortunately, relationships that have had trouble or have had those cracks, they tend to deteriorate further. And so if you are struggling with that, trying to see a therapist, find a relationship counselor, if it's a family relationship of some kind, mother, son, father, daughter, sibling, friendship, that can be a little bit more challenging. But again, finding some kind of therapy to work through those issues is really important with those psychological changes that can kind of happen. People can also feel deprived from not tolerating foods that they maybe liked before, not being able to eat as much as they once could. That can be especially difficult around the holidays. We've kind of just got over that hurdle a month or so ago. But that's when I really tend to notice it for people is holidays, family reunions, that deprivation kind of tends to set in. When you have birthday celebrations and anniversaries and you're used to going to a specific favorite restaurant and maybe you're not able to eat as much or to eat the foods, depending on what step of the diet you're on, that can be hard. And that's a tough feeling to deal with. And then there's always the potential for that transfer of addiction. If you or someone really struggles with the addictive eating patterns, if you have had a family history of alcoholism or drug abuse, that's definitely a potential worry. However, I've had very, very few out of the hundreds, if not thousands, of patients that I've worked with over the years. I've had very, very few people that were true transfer of addictions. I feel like this is something that the media and some healthcare professionals like to really kind of put as a potential option with surgery when people have it, that transfer of addiction happens. But I've had very few people that have been true kind of food addicts that have turned into kind of an alcoholic as a result, or a drug abuser. It just is not as common as what people like to think. Surgery can also kind of have a ripple effect in your life in many areas. Your emotional state is often improved because you're feeling better. People have decreased symptoms of depression, or they have periods of depression that are less than what they used to be. They tend to have less physical pain. A lot of times people will have career changes, and this isn't so much because they are fired from a job, but more so that they have more confidence. They want to maybe pursue a different career that they didn't really want to before, that they might have felt stuck in before. Relationship changes, again, can continue to happen. And friendships, a lot of people will develop new friends from going to the gym regularly, or joining different groups that do kind of a healthy recipe swaps or whatnot. So your friendships, you'll find, will change. Or if you've had friends that also struggle with their weight, and maybe they haven't lost the weight, they may view you in a different way sometimes, and sometimes they can even be sort of jealous. And so that's kind of a relationship that you'll have to be patient in, and really understanding of maybe where those people are that cared for you before surgery, and they're kind of wondering how they fit into the mix now too. So psychological changes continue. Now these 7 steps to improving emotional adjustment after surgery, I borrowed these steps from Lynn Rotsong-Wiekers, and she's a social worker. And I think this is a really good list of steps to just kind of focus on as you go through the process of surgery. To keep in mind, you can either write these down, or you can go to the link that will be on, I believe it's on the next slide, to find the full article yourself. But I think this is a nice way to really kind of hone in and focus and read through this maybe every few weeks to kind of know those different steps that you'll be going through. So first, it's really important to just listen to your doctor's orders and any recommendations that the other healthcare professionals have given you. You need to take care of your physical needs before you can take care of any emotional needs that you may be going through. It's kind of like that hierarchy of needs, if you've ever seen that in a psychology book or a social book of some kind. You need to take care of your physical needs before anything else can be accomplished. And that's the same with surgery. If you're not able to eat the foods you need to eat and to get enough hydration in and your vitamins and minerals, your emotional health is going to be second to any of those other things. Once you do have that physical health, journaling is a great way to kind of keep track of how you're feeling physically and emotionally. Helps you keep track of, the foods that you're eating, maybe any cravings that you're having. If you are feeling deprived at all, just writing that down, acknowledging it can really help to kind of overcome those feelings and emotions. Setting realistic expectations. This is extremely important with weight loss surgery, and then really being willing to modify them as time goes on. I've had a lot of patients throughout the years that have, put a goal down and they think it's very realistic and very attainable. And as they go through this whole process, they realize that goal is either going to take a lot longer than what they realized, or it's maybe not a very realistic goal for them initially. And so, having the guts to really modify that goal is important. And then once you do have that goal, writing it down and looking at it frequently. Because if you look at it and think about it and take hold of it, every single day or every week, it keeps you more focused than if you just kind of have it floating around in your brain. So write it down, put it on the fridge. I had one patient that put it in his closet. He kind of kept a running tally, and as he would reach a goal, he would check it off or he would cross it off, and he would kind of try to write another one down just to keep those goals going and to keep that motivation set. Reflecting on the past is important. You really want to remember that moment that you decided to have surgery and to kind of grab your future and rush toward it for long. And so, you don't have to necessarily remember the negative things in your past, but really reflecting on what was that deciding moment for you that, yes, I'm going to do this. Yes, I want to have surgery for myself. Along with that, taking lots of pictures as you go through the process of losing weight, making sure you have maybe your measurements, keeping a pair of pants. These are all things that you can do to kind of remind yourself of the different steps that you've been through. And this is really important when you've had weight loss plateaus, because the plateaus are especially frustrating. Everyone experiences them. It's just part of the process, unfortunately. And so when you're going through one of those plateaus, to be able to maybe look at the picture that you took the day before surgery, or to see that pair of pants that you had on, the day you came home from the hospital, those little reminders of how far you have come can really help with the different changes that you're going through, psychologically. And when you do have those rough patches where the weight is maybe not coming off as quickly as you would potentially like it to be. And number 6, I think, is one of the most important ones. And that's really seeking help if you find yourself having difficulty adjusting to the many changes after surgery, or have really hit a roadblock mentally, physically, emotionally. Having the guts to come out and to say, hey, I need some help, or I need a pep talk, or I feel like maybe I'm doing something wrong. That's okay. That's what we're here for. Just because you've had surgery doesn't mean it's a one and done kind of thing. And that's why I'm here as a dietitian is to help you get through those more difficult times, no matter what step of the process you're going through. And then just remembering to live life to the fullest. You had surgery to improve your life and to be healthier for you and to be happier. And so really taking a hold of that. So before we kind of go on to more of the relationship section of the stigmas of weight loss and kind of how to handle that, I wanted to discuss the obesogenic environment that we live in, because clearly something in the last 30 years has really changed in our environment to lead to the highest rate of obesity that we've ever had. Now it has come down a little bit, we know, over the last few years, but overall we know that it's much higher than what it has ever been and really what it should be. So there are some things in your environment that you may be able to go through this list and say, yes, I know that's something that affects me, or this one doesn't, but I know that one does. Or if you've maybe, only one or two of these will pertain to you now, but in the future, maybe more of them could. And so just kind of being aware of where these obstacles are, I think can help in this whole process of weight loss and staying healthy and kind of overcoming those stigmas, or just knowing where those potential pitfalls are for all of us. So some of the things that have led to this sort of obesogenic environment include, people having less access to parks in their communities, increased crime rates in specific neighborhoods and cities. Current farming policies and regulations are actually kind of, they're set up for big agriculture. And so currently we don't have enough farming land for the fresh produce, the fruits, the vegetables, for every American to really meet their dietary guideline needs. And so that's a big issue, and that leads to potentially higher prices for certain fruits and vegetables. So that's kind of something that we can try to work with our political leaders to hopefully change. Having limited access to good grocery stores. This is one that I can speak to recently. My husband and I moved from a major metropolitan area to a small rural farming community where, we have a local grocery store, but to get really good, fresh, organic, fruits and vegetables, we have to drive about 35 to 40 minutes. And, with a young family, that's just not feasible during a normal week. So, we have to take, once a week or every couple of weeks, make a big drive and go to a grocery store to invest in those good foods and to bring them home, because that's what it is. It's an investment for our health and for our children's health. Another issue is, neighborhoods not having sidewalks. So a lot of times, especially new neighborhoods that are getting developed could be very nice, but they might not have sidewalks installed yet. And so, that can be an issue depending on where you live with going outside and being active. Also having, higher calorie foods and convenient packaging. This has been a major issue over the last 1 to 2 decades of all of these foods all of a sudden coming in, single serve packages. And while that can be good as far as portion sizes go and controlling those portion sizes, it can also be negative, because a lot of foods that are high in calories, that are high in fat, that have very simple ingredients with lots of, sugar and white flour and don't have a lot of nutrients, can be packaged very quickly and easily. And these, especially if you live a busy life, can be very tempting because it is easy. So just thinking about these things, knowing that they're out there, will hopefully just make you more aware and less likely to fall into those kind of environmental traps. So kind of what can we do to stay away from those traps? The Institute of Medicine has recognized that sugar-sweetened beverages have the strongest link to obesity than any other food or drink out there. So that means sodas, juice, added sugar drinks like a frappuccino kind of coffee drink, milkshakes, smoothies, the Capri Sun kind of drinks, not to throw them under the bus, but those sort of kids kind of juice box drinks all have those added sugars. And so really making sure to try to limit those as much as you can. And when you do have them, to make sure it's not something that's entering your diet on a regular basis. Encouraging our political leaders to, adapt new farming policies, go to a city planning meeting and, talk to your community and your city planners about, sidewalks and adding extra parks. If you have young children or grandchildren, seeing what you can do to maybe incorporate more anti-obesity efforts, whether it's installing healthier vending machines or maybe changing the school snack system a little bit or the lunch programs. Medical coverage for obesity treatment has actually improved, believe it or not. I know the Obama healthcare legislation has kind of been a big topic, at least where we live, and there are a lot of differing opinions on it. And unfortunately, there's not a medical system or insurance system that's perfect. I wish there was. It'd make all of our lives easier. But one good thing about Obamacare is that they are covering more treatment for obesity than any other insurance policy has in the history of the U.S. So that's an exciting change, and hopefully it'll continue to get better as time goes on. Food supply and distribution, kind of going along with that grocery store and making sure that good foods reach all of us, no matter what community we're in. And also, the media and the marketing efforts of major food corporations, getting them to market healthier foods, to package healthier foods. That's really important. Instead of having a bunch of sugary cereal commercials on TV at 9 a.m. on a Saturday morning, trying to get healthier foods marketed is going to be a very big thing for the future generations and preventing that obesogenic environment. So now we'll kind of switch gears into different relationship changes after surgery. So I borrowed this information from Dr. Walter Medlin, and his article was on the Obesity Action website. And I really like this because it kind of goes through each relationship that people experience throughout potentially the course of a day, and kind of how surgery and sort of weight loss affects that relationship. And the best thing that it starts off with, and the best way it starts off, is going to, yourself first, and really remembering that, if you don't have a good relationship with yourself, these other relationships are going to suffer no matter what kind of weight loss you've had or what you've done with surgery. So really making sure that you take care of yourself, that if you were in a pattern of self-neglect, that you try to get out of that pattern, that we're not self-berating, that we're allowing ourselves to make mistakes, but continuing to work on making those changes. Practicing different internal mantras is very important. I had one patient that would put she would tape a piece of paper with the "I'm worth it" quote on it, and every morning she would kind of put it over her alarm clock. So when her alarm clock went off, the first thing she would see when she went to turn it off was that little piece of paper that said "I'm worth it." And every morning that was just kind of what she needed to really kind of get her out of bed, and to remind her that this day is for her as much as it is for anybody else. So I really like that and kind of wanted to pass it on to you. Taking a stand against that internal critic that you have. A lot of times, people that have struggled with obesity or weight issues, they tend to be hardest on themselves, and that's difficult. And so again, kind of reminding yourself that you're not perfect and that you are worth it. And support groups. I know if you've listened to the webinars before, I've really encouraged this, and I'm going to continue to encourage it because I think it's extremely important. But going to support groups, finding those people that have stood in your shoes and can help you through those rough patches, or maybe you can help them through rough patches. That's a great place to really focus on you and kind of what you need to do long term. Your spouse and significant other, this is the person that really has the most at stake for change in your life. And as Dr. Medlin describes, this is the person that really loves you the way you are. And they're kind of afraid sometimes of losing some version of you when you go through weight loss surgery. And so, including your significant other or your spouse is really important through this process. Trying to get their support whenever possible. And most support groups do encourage people to have a support person with them, whether it's it is a significant other or a friend or a sibling, but you'll find more often than not that they definitely encourage having a support person there. So this relationship, can also just kind of be complicated by the different, strains that happen during the surgical process. So especially further out from surgery, this relationship can change because maybe one person has more energy to do things, or there's a role reversal where, before maybe the wife was always the one that wanted to go do things, but now that the husband's had surgery and he's feeling so much better, he wants to do more that maybe his wife doesn't care to do. And so that can be a definite challenge. If both partners are obese and now one is significantly lighter, there can be some jealousy issues there as well. And if your relationship was strained to begin with, again, surgery usually kind of puts a little bit of a further strain on that. So something to really think of and to kind of plan for. And then just, your food and activity changes. Date nights aren't what they used to be. I had, one couple in particular that their thing was to go to the movies. Almost every weekend they went to whatever new movie was out. And part of that ritual was that they would, get popcorn, which I think, almost all of us do, and not, I don't think they overdid it and, got giant bags of popcorn, but after surgery, the husband couldn't tolerate popcorn very well, and so when he would go to the movies, he kind of just had this constant reminder of what he couldn't have, and so they kind of gradually got out of going to the movies, and it took, I think, a solid year for them to kind of find something that they both enjoyed. But now they're avid bicyclists, and especially when it's warm outside, they'll kind of go all over the area and do different bike rides. They'll, take the ferry and go to different places to ride their bikes on different islands and whatnot. But, that's just kind of one example of how one couple really had to change what they enjoyed doing together for, their overall health. So your relationship with parents can even change after surgery. Mothers, I found, especially can kind of have a stressful time with this because, as moms, we tend to think that we have kind of control over our children and kind of take the weight issues a little bit more personally, or think that maybe we created them. And so your mom might be a little bit more sensitive with these issues. Dads are a little bit more difficult to predict. I think Dr. Medlin did a great job of kind of explaining this, and that, they can kind of be more withdrawn and quiet, which may seem like disapproval, but these, parents and especially fathers can really be very good vocal supporters once they see how much of a tool surgery can be for you to help with your weight loss process and just your overall health. Now, children and siblings, different family structures can make this one a little bit more difficult. If you have children still at home, this can be a challenge with trying to keep those occasional foods around the house that, you want your children to be able to enjoy, on a, maybe weekly basis or something. But you also have to be fair to yourself and make sure that you don't keep any foods in the home that are also sabotaging you. So there's that kind of give and take that you have to have, especially when you have children or maybe even other family members that live in the home. Now, work colleagues, this is kind of a funny one. This is where I found a lot of people really struggle with patients and get the most frustrated, because work colleagues are frequently uninformed on surgery, and they're kind of the first ones that want to tell you the horror story of, someone that maybe they used to work with, or a friend that had surgery and gained all the weight back. And so, these individuals specifically, you tend to have to be a little bit more patient with, and to really educate them on the changes that are required, and if you feel comfortable, maybe some of the changes that you're continuing to work on. Now, strangers and friends, knowing when to share your weight loss process can be kind of tricky. I found that some friends, especially, will say, or maybe even coworkers will say, oh, now that you've lost weight, I can tell you, whatever, some horrible comment, or I can say this now that you're skinny or something. And so that's a really tricky thing. Or strangers might say something really offensive about someone that's overweight or obese, not knowing that you used to struggle with that. And so, this can be particularly difficult, and just trying to be patient, to be forgiving, to know that because someone maybe says something that's not very sensitive or that is rude, that they're not necessarily a bad person, and this could be a learning opportunity, and saying that, hey, I used to struggle with obesity. It's a difficult process. I had a long road to getting healthy. And, I always like to throw in that, people tend to struggle with more than what that meets the eye with struggling with their weight. And that way people can hopefully understand that this isn't just an issue of um, I'm eating more than my body needs. There's so much more involved with weight loss struggles that we know. And so part of overcoming that stigma is to educate people on the other issues that are going on. And so really trying to be patient with them is one of the most important things that we can do. All right, I know I went a little bit over there. I'm trying to kind of keep us on schedule here. So we'll go to our questions tab. I'm going to have to exit out here. Okay, so our first question is, how do I share my weight loss journey with strangers, coworkers, or old friends? So again, I think this can be a little bit tricky. If the weight loss conversation does come up in conversation, I think it's good to remind people that surgery is not the easy way out. I'll encourage people to say something like, I've had weight loss surgery, and while it helped me to lose the weight, staying healthy and maintaining my weight is a decision that I make and that I work hard at every day. And reminding them that there's nothing easy about losing weight, no matter how you go about doing it. And sometimes if you want to keep it quiet to people, but it's obvious that you've had some weight loss, you can say something to effect that you're working really hard on watching what you eat and exercising to be healthier, and just kind of leaving it at that. If you don't want to tell everyone your business, that's completely fine. Kind of keeping it short and sweet, and just tell them that you're working really hard, and just kind of walk away. They'll get the idea that you don't want to talk more about it, and hopefully kind of leave you alone. All right, our next question. Let's see, there is definitely a genetic component to obesity in my family, as all of my siblings and most of our children are obese. What can we do as a family to lessen this risk, especially with children at home? So this is a tricky thing, and kind of, as we talked about earlier, that relationship, especially when there's children at home, can be tough with the balance. So I think the best thing you can do is to try to be the change that you want the family to be. Choosing to surround yourself with healthier foods, and really, once again, having all those foods in moderation. Setting yourself up to be an example for everyone is a little bit better than kind of forcing or guilting people into trying to be healthy. It's important for children to really see adults enjoying healthy foods, but occasionally having other things like, ice cream or chips, as long as it is in that kind of healthy, moderation. And, that it's important to show them how to eat those foods responsibly, and that they can be enjoyed again in that moderation. I really encourage adults to not force kids or grandkids to eat everything on their plate. If dessert is being served, serve a small portion with the rest of dinner so that you don't really kind of put that focus on, oh, dessert's so important that we save it towards the end of the meal. And this is something that I actually just dealt with my family and my parents is, telling them that it's okay if my son has a piece of cake before he has his entree. It's I want everything to be there and he can choose what he wants to eat. And, yes, kids will go for the dessert frequently if that's served with the rest of the meal, but they'll also tend to eat, some of those vegetables and some of the main item. You don't need to give them a huge piece of cake. You can give them a small piece of cake while also giving them, some steamed broccoli and some meatloaf or a baked potato, but kind of making sure that you don't put an extra emphasis on chips or on cake, or because you ate your broccoli, now you can have cake. It's not, we want to kind of take the reward end off of some of those foods. Another thing that I think is really important is to not reward yourself with food or loved ones. Trying to, if you kind of were in a household that used food as a treat, trying to find something else. So, maybe if the kids got an A on their report card, taking them to a movie or to the zoo or buying a new toy instead of, taking everybody to go get ice cream. I hope that kind of makes sense. I know I tended to ramble there, but there's a lot of information that can kind of go into that question. All right, so the next one, I live in a safe neighborhood, but there are not any sidewalks to walk on and only a few short roads that lead to busy roads that are not safe for walking. What can I do? This is a good question. And actually, this is kind of something that I used to struggle with when we lived in Michigan, is that we were in a safe neighborhood, but there weren't sidewalks, and everywhere around us was really a road that was too busy to walk on. So personally, this is just kind of something I did, is when I would go to work, I would bring extra clothes, my workout clothes, and I would try to change before I left work, and I would go to a park on my way home. And it was a few miles out of the way, but it was, once I had my workout clothes, it was very easy to get there. And to, even if I, spent 10 or 15 minutes, it was kind of better than nothing. At least that's the way I looked at it. And that's kind of the way I've been taught to look at it with my profession. But I think that's something that's really easy to do. Or if you're going to go run some errands, put on your workout clothes if it's a weekend before you go and run your errands, and do everything you need to do. And then when you're on the way home, once again, hit up that park or maybe stop in a different neighborhood to go for a walk. I think that can be really nice, just to kind of get a change of pace or to get some new scenery is going to those different neighborhoods that do have nice sidewalks. I always like to go to the ones with the nice big houses so you can stare at the different homes around you. But not being afraid to get bundled up if it's cold outside and to go to a different neighborhood, or to kind of get in your car and try something different around town. All right. So what do you mean by have a realistic goal with weight loss? Okay, so having a realistic goal, it's important to have kind of other measures of success that go beyond the scale. I think a lot of people before surgery think, once I get down to, 165 pounds, I'll be happy. Or once I get below 200 pounds, I'll be happy. And that's really not the case. Other things in life are the things that usually bring you happiness. It's not just a number on a scale that once you hit it, all of your other problems kind of go away. And so, I think a good realistic goal for people to really focus on is, you can keep that weight goal in your mind, but thinking of other things such as, I want to decrease my medications so that I'm taking maybe 3 medications a day instead of 6. Or I want to be able to take a walk with my spouse without feeling out of breath. Or I want to, get down on the floor and play with my children or my grandchildren and be comfortable. These are different kind of goals that you can kind of think of, just to give you an example of something that's realistic that doesn't necessarily have anything to do with what that number is on the scale. All right, looks like we got a couple more questions. How do I find a support group in my area? So this is good. This is actually something I just did a few weeks ago for someone. If you go to the obesityaction.org website, and I believe it's under their advocacy section. I can post this to our Facebook page too. I'll have to kind of go online and do it again. But again, it's the obesityaction.org website. And they have a link that you can go to for support group. And it's set up really nice that it breaks it down into each state. And then you can go to your specific state and scroll through the cities, and it will show you different support groups in each city. And it's nice because it gives you usually a contact information. There's frequently a phone number or an email and an address so that you can find more information about that specific support group. And I really, along with that, I would encourage you to go to support group, as I've said before. But if you do go to one and you find that it just doesn't feel right, don't give up. Trying to go to that same support group maybe a month or 2 later. A lot of times, support groups don't feel quite right, and they might not have a good topic that month, or different people with strong personalities might be going at that time, that if you wait a month or so, the kind of the people sort of rotate through. And so it's good to try and go back every now and then. Don't give up if you go to a few and it just doesn't seem quite right. Keep going. It almost always gets better. Or trying to find a different one in your area is really nice too. Even if it's an hour away, usually support groups only meet once a month, so it can be a good little field trip to take to find a support group that you really like and that you can connect to. All right, looks like one more question. It has a couple questions within it. So I have 3 children at home between the ages of 8 and 16 years old. Oh, how do I make healthy changes without depriving them? Good. This is a good question, and kind of briefly discussed it, but finding a balance with foods at home can be pretty tricky. I encourage you to have sort of healthy, convenient foods available for them, along with some occasional snacks as well. So something that I do is I'll have maybe carrot sticks at home with some cucumbers and hummus for a quick after school snack, but then I'll also have a fruit roll up out. So they're getting those vegetables and a nice healthy dip, but then there's a little treat as well. Or one thing that I've had great success with my kids and friends' kids that I've told to do this is making fruit cheese kebabs. So just kind of how you would do like a shish kebab on the grill. You would just cut up different pieces of fruit and have different cheese, or you could do olives, and just putting it on a little skewer. And you can make those ahead of time and wrap them in plastic and keep them in the fridge. And kids love these. They're colorful, they're fun, and they keep really well, which is super nice. Something else you can do with kids, especially if you have kids at home, ordering pizza is probably pretty common, especially if you're working. So again, this is something that we do at our house is we'll put the order in for the pizza, and then we usually make a really big salad, and everyone has a nice healthy bowl of salad while we're waiting for that pizza to either get picked up or to be dropped off. And that way, almost everyone's getting a nice healthy serving of vegetables before the pizza comes. And it also tends to help with portion control because once you've had that large serving of veggies, you usually, don't have room for a whole lot of pizza, maybe one or two slices, but it can kind of help with that portion control. And if you've, had surgery recently, that, you maybe try steamed vegetables as opposed to raw veggies, or you could do the veggies in the hummus or a low fat dip and then just steam them for yourself. There's kind of some moderation and some flexibility that you can do so that you're getting the healthy food that you need, but your family's also getting healthy food and some of those those fun items that we all like to eat occasionally. All right, so I believe we're about at our time. I don't have any other questions, so I'm going to go ahead and end our webinar now. Once again, I'd like to stress if you would like to join the Mexico Bariatric Services Facebook support group, that's an excellent place to ask questions, to get feedback from other patients. And again, you can also go to that knowledge base section of the Mexico Bariatric Services webpage to find out more about surgery, what it entails to have surgery with the medical tourism company as well. All right, thanks everyone for joining us today, and we'll end our broadcast now.